Well, good morning to you all. So I would like to start by thanking Congresswoman Lee for her continued dedication to reaching an AIDS-free generation, including helping put this briefing together along with Advocates for Youth and the other founding partners. Today is a day I find my heart quite joyous. Not only because today is the first National Youth HIV and AIDS Awareness Day, but I now have been living 4 years healthy with HIV. I found out I was HIV positive on April 5th, 2009 at the age of 17. And as I lay in that Cleveland hospital bed, I had a moment in my mind where I asked myself this question: do I get busy living or do I get busy dying? And quite frankly, I chose to get busy living. I owe a lot of this in part to my AIDS service organization back home, the AIDS Taskforce of Greater Cleveland, and the programs it provides through its youth center, the Beyond Identities Community Center. They provided me with a space as a young gay black man to be myself in a supportive environment. I found other people who had been through what I went through, being discriminated against for having HIV, having my status outed by supposed friends, and being turned away by members of my own family. Without them, without the task force, I can honestly say that today I honestly don't know where I'd be. The staff at the AIDS Task Force of Greater Cleveland have been remarkable, and in particular, I'd like to point out Mikhail Brazil, my mentor and the Director of Prevention Programming and Education. He taught me HIV and AIDS 101, community engagement, and on a more personal note, he taught me how to look at every situation that happens in life as a teachable moment. The second is Judith Pendell, Director of the Ohio Advocates Youth Leadership Council. She taught me about advocacy in its many forms, but most importantly, she taught me how to use my story to help my community and be a voice for the voiceless. In my journey, I have been able to navigate the many systems of care, in part due to my own drive to be involved in my continuum of care, but also because I was given training to keep pressing on when things got rough. For example, my job recently changed insurance plans, and because of this, co-pays for my medication, which were previously of no cost to me, increased to $120 per month. I fought for 10 weeks with my insurance company to get the issue resolved, and because of this lengthy battle, I've been without treatment for nearly a month. I had never had the experience of being without HIV treatment since I found out I was HIV positive 4 years ago. But it is because of programs like the Ohio Advocates Youth Leadership Council, the Empowerment Project of the AIDS Task Force of Greater Cleveland, which previously received CDC funding, that I felt empowered enough to stand up for my health care and myself. While I've had my share of personal victories, I've also experienced a fair share of setbacks. And the one that sticks out most to me is when I was forced to make the choice to either keep my job at Case West Reserve University and lose my state-funded health insurance, or resign and have no source of income, but keep my health insurance. My income of $600 a month, $600 a month exceeded the program's guidelines. And it is unthinkable that today in America, anyone is forced to decide between being able to support yourself, living a productive life, or having access to life-saving treatment and care such as I did. I've also had the honor of being a part of the National Black Gay Men's Advocacy Coalition's Young Gay Black Men's Leadership Initiative. This group of young leaders has found a way to provide information, education, and training on the latest advances in HIV and AIDS treatment and research to emerging young gay black leaders. Also to provide updates on federal policies and how they specifically affect our community. Programs and organizations like the Ohio Advocates Youth Leadership Program, Advocates for Youth, and the National Black Gay Men's Advocacy Coalition are perfect examples of programs working to help build a stronger youth community, which is one of the core guiding principles of fighting HIV and AIDS. National Youth HIV and AIDS Awareness Day is a day for young people to stand up and say that we will fight to the very end. We will not be the generation to be decimated by this disease. We will continue on until we have achieved an AIDS-free generation. Well, like I mentioned at the beginning of the speech, I chose to get busy living. And it's because I made that choice that I'm able to stand before you today as a vibrant example that young people can overcome great adversity when given the support and tools they need to find the light even in the darkest of hours. We are at a pivotal moment in the fight against HIV and AIDS, And National Youth HIV and AIDS Day is Awareness Day is a step forward in helping my generation end this long and hard-fought battle. We will do what is hard. We will achieve what is great. And this next part I cannot emphasize enough to every single person in this room. With all of your help, with all of your help, my fellow HIV positive young people will be able to usher in a generation that is truly free of AIDS. Thank you.